What do you think happens to the baby in your womb during a miscarriage? And what do you think happens in your womb after a miscarriage? Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. And in today's video, I'll be answering one of the questions that was asked in the comment section in my previous video. Feel free to leave a comment or a question. Yours might be answered next. So one of my followers actually asked, if you had a miscarriage, but the ultrasound shows that there are some retained products in the endometrium, can these retained products again form a kid in the womb after a miscarriage? The simple answer is no. Let me explain. When a miscarriage happens, the pregnancy has already stopped developing and the baby is no longer alive. It is not something that can be reversed or treated medically. There is no solution for death. The body then tries to remove the pregnancy on its own. Sometimes the body removes all the pregnancy tissue naturally. Other times, some pregnancy tissue remains inside the uterus. This is what we call retained products of conception, or simply retained pregnancy tissue. What I am calling the uterus is what we all know as the womb. So this tissue is not a sleeping baby, or a baby waiting to continue growing, or a baby waiting to get treated. No. Once the pregnancy is no longer viable, that means once there is no more fetal heartbeat, any tissue left behind cannot develop into a baby again. Instead, retained products may cause problems such as continuous or heavy vaginal bleeding, persistent lower abdominal pain or cramping, infections which may be present with fever, foul-smelling vaginal discharge, or worsening pain. Sometimes, these retained products can even delay the uterus from returning to its normal size. This is why an ultrasound is recommended after a miscarriage, and medications to help the body pass out the remaining tissue, or in some cases, a minor procedure is used to remove it. However, not everyone with retained products needs a procedure. The best treatment option depends on how much tissue is left, whether you are bleeding heavily, whether there is an infection, and how you are feeling overall. So remember, retained products of conception cannot become a baby again. If an ultrasound scan report shows a retained pregnancy tissue after a miscarriage, it is important to follow up with your healthcare provider so you can receive the appropriate treatment and remove the retained products to prevent possible complications or infertility in the future. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and your question might be answered next. I'll see you in my next video.